Very good evening, Dr. Jai.
Hello, Mala Ben. Hi, Kem Cho. Fine.
Bas, ekdam fine. We are streaming live on Facebook. And
Thank you.
today is our seventh consecutive day of Facebook Live series, starting from various doctors from Chennai, Bangalore, Mumbai, Ahmedabad, right? And we had doctors from various specialities who were our endocrinologists, gynecologists, genetic lab managers, right? And we had amazing sessions, and we have kept the last session booked for you, especially as the closing series to close our series. And today is the world is celebrating, World Infertility Awareness Week, where it is a request from all the infertility specialists to all the patients that you have to come forward and believe in yourself and believe in the medical miracles. The team of infertility specialists across the world are here for you, and it is not a taboo. So, hello, viewers. Here we have the most awaited sessions of the week with Dr. Jai Mehta with us, the famous gynecologist of Mumbai and expert in the field of male infertility and endometriosis. All those patients who have lost hope, especially in these two areas, because of these two indications, Dr. Jai has fulfilled dreams of not hundreds, not thousands, but more than thousands. So, Dr. Jai, once again, welcome to our channel. And as always, thank you so much for your never-ending and everlasting support that you have with us at Khushi IVF. And today, we once again welcome you on this page on the male infertility session.
Thank you so much. Thank you so much.
Right. So, this is a long form kind of a session where our viewers have already given us questions.
Okay.
And they would like to ask these questions to you. So the first question is on why do males suffer with male infertility and why is it increasing?
See, on an average, if we are trying to study fertility, then approximately 30 to 35% of all the fertility is going to happen because of the male partner's problems, right? And that is something which is very important for people to understand, especially in an Indian scenario. Because what people normally think that it is always the female partner who is going to be at fault. Okay. Normally, it is not like that. Normally, the fault is also with the male partner. And a lot of times, this fault of the male partner is an extremely treatable fault. That is something which people don't understand. So they always think that, oh, male infertility, mere ko kuch.
Right. Dr. Jai, we can hear you now. We lost you in between because of
no. What I meant is that once the male ego settles down, normally, okay, once the ego settles down, males come for treatment. And when they come for treatment, they do the best treatment. I'm telling you that also. In males, the big problem is getting them to do the treatment. Okay.
Right.
Once they are doing the treatment, they are the best people to handle. They are very honest. They are very straightforward. There is no hanky-panky. They will do all the treatment correctly. The difference and the problem is getting them to do the treatment. Okay. So I think that is the only challenge which we face in male infertility.
Right. So with lot of signs ahead, we have a lot of discussions with you. But now since आपने male ego की बात छेड़ ही दी है, तो आप वो भी टिप्स दे दीजिए कि मेल अपने ईगो को कैसे डील करे. You know, how does he convince himself that look, this is the male ego in place right now, and this is how I'm gonna deal with it.
See, honestly, usually when somebody has an abnormal sperm report, okay, after repeating that report, like after repeating the report 1 or 2 times, usually he comes to know that, okay, you know, there is a problem. Ye baat to they will come to know. So what do in that situation? Either they change the doctor, okay, or they change the treatment. So for example, let's say somebody is doing homeopathic treatment, they will change, they will do it Ayurvedic. Somebody is doing Ayurvedic treatment, they will change, they will go to homeopathic. Somebody who is doing, has done both, will then come to an allopathic doctor. So that circuit keeps on revolving. And that is common. This is normally going to happen for 1 to 2 years. ये 1 to 2 years हो जाने के बाद में, there are going to be males who are not going to respond. They know it, heart in heart, they know it. Okay. उसके बाद में somebody will tell them कि यार देख, you will have to do treatment. And by that time, so you have to give them that time, that 1 to 2 years, if you are willing to give, everybody comes back to you. Okay. I have seen that in the last 7 to 8 years. The people whom we tell with azoospermia that आपको surgery करने की जरूरत पड़ेगी. Okay, these are the people who will then do all other therapies. So now we only tell them that if you have not done Ayurvedic, go and do it. If you have not done homeopathic, go and do it. क्योंकि वैसे भी उसमें कोई result नहीं आने वाला है. But go and do it. Understanding, so that you satisfy yourself that you have done everything. Okay. Once you know that treatment of choice is lying down in front of you, they will come back. They will do the treatment. And yeah, so as far as handling male ego is concerned, I think it is very similar, very superb. You give them time. Don't force them for anything. Let them do their research. Okay. करने दो research. वो research में वही पढ़ते हैं जो मैंने लिखा है YouTube पे. Okay. और फिर मुझे ही आके बताएंगे या आपको आके बताएंगे. So it's okay. Let them do their research. Let them be satisfied. It is important for a male partner, or it is important for any patient. Okay, for that matter, to be convinced that they are doing the right treatment. Right?
Right.
So the minute they are convinced, they are going to do it.
Right. So now the second question very nicely answered, and probably you have solved a question of many infertility specialists also, that how do you counsel? Do they require a counselor, or do they require a family member to counsel, or what? But ultimately,
honesty is the best counseling. Understanding? If you are not going to do a particular treatment to your brother, to your best friend, then don't do it to your patient also. See, the only thing a patient can do is he can change the doctor. ठीक है? उससे ज़्यादा वो कुछ नहीं कर सकता. I am any which is the most expensive doctor of the city. तो अगर वो मुझे change करेगा तो कोई ऐसे ही डॉक्टर के पास में जाएगा जो मेरे से कम कंसल्टिंग ले रहा है या मेरे से कम प्राइस में ट्रीटमेंट दे रहा है. Then how should it matter to you? You know, that should not matter in my opinion. Give them time. Once you give them time, be honest in your counseling. Don't be dishonest. Be honest in your counseling. If you are honest in your counseling, they will come back to you.
Got it. Got it. Absolutely. So now going forward to this, you have answered probably one of the most difficult question of the session by the beginning of the session itself. Now let us go forward and ask, there are a lot of patients, Dr. Jay, who have already done microtessa. So this is one of the questions from our viewers only. Yeah. They have already performed microtessa and they have not found sperms. So
yeah.
Do they again have to, come and look forward for a specialist, an expert like you?
Yeah, I mean, this is again a no-brainer. It is like this. Somebody tells you that, I have done a particular treatment at a particular location. Good. It's very good to do it. God bless you in that. But ultimately, there are only a few people who are experts in doing a particular microtessa. What is microtessa? Remember, you have to open the testis. You have to put the microscope. You have to study the testis. Okay. And you have to find sperms. Testis open करने का तो government ने अभी general surgeon को भी permission दे दिया है. गायनेक को तो है, यूरोलॉजिस्ट को तो है, एंड्रोलॉजिस्ट को तो है, जनरल सर्जन को भी परमिशन दे दिया है. बराबर है. माइक्रोस्कोप इज अ मशीन. तुम्हारे पास में 25 लाख रुपए आए तो एवरीबडी कैन इन्वेस्ट इन अ माइक्रोस्कोप. नो प्रॉब्लम. ठीक है. द प्रॉब्लम इज नॉट हैविंग ओपनिंग द टेस्टिस एंड पुटिंग अ माइक्रोस्कोप. द प्रॉब्लम इज वेयर टू लुक इन द टेस्टिस. इस चीज का आंसर बहुत कम लोग के पास में है. एज अ रिजल्ट ऑफ विच approximately 85 to 90% of the patients whom we see are at least one microtessa done. Okay. And out of those 85 to 90 whom we see, 30-35 will again get sperms.
Right.
That is because our previous colleague was not trained enough, was not expert enough, and he or she did not know where to look in the testis. So if they don't know where to look in the testis, you are never going to find sperms. And as a result of this, even if you want to have a doctor who comes to your home and does microtessa, right? You need to ensure that that guy is an actual expert and that guy is not an expert on paper. Understanding there is a big difference being an expert and being an expert on paper. And I think as an intelligent patient, that is something which you have to design, decipher, and get through.
Got it. So there is a chance of around 25 to 35% for a patient who have performed a microtessa previously and now they are coming and having it done from an expert like you, that they will still hold a chance and they should not just think कि मेरे को पहली बार नहीं मिला तो मुझे दूसरी बार करने की क्या जरूरत है. Right? So wonderfully answered, and you have also answered that where to look and why a surgeon like you, a specialist like you is, needed for a further consultation. Right. Dr. Jai, the third question is, what is the difference between TEFNA and microtessa, or they are one and the same?
No. See, TEFNA, before people do microtessa, they put a small needle inside the testis. TEFNA actually is testicular fine needle aspiration, basically. Okay. And that is also a very effective procedure for patients who have obstructive azoospermia. That is also a very effective procedure if in case you want to do a trial before doing a microtessa, right? And that is a good procedure that is done under local anesthesia, and countless patients have benefited out of it. So there is no harm in doing that procedure at all. Okay, absolutely no harm in that doing that procedure, but indication should be if the patient is having obstructive azoospermia.
Right.
Primary indication.
Understood. Now, the fourth question is, not everybody can, have a chance to travel to Mumbai. So, what are the various locations in India where Dr. Jai, you travel and you consult for male infertility?
Oh, I mean, we are present at a lot of locations, right? So, Mumbai is there, Ahmedabad is there, Pune is there, Bangalore is there, Chennai, Hyderabad, Delhi, Agra. And I think we are very soon starting Kerala and very soon starting Kolkata and Indore. So 3 more locations we are starting in order to meet up to this demand.
Right. So on this World Infertility Awareness Day, we will post this session. We will put a post tagging you, stating that Dr. Jai, in order to treat for male infertility, will be available on these various locations, so that patients across all the cities of India, all the states of India, can take your advantage and approach you whenever they feel like. So next question is, other than that, who treats male infertility? This is a very a topic which is generally discussed a lot, that who treats male infertility?
In India or anywhere?
In India in general. So that is what, is it a urologist? Is it a general surgeon? Is it a gynecologist? Who treats male infertility?
I think this is a very good question, because people are wondering and worried about who treats. They are not worried and wondering about how is the treatment done. See, even if an MBBS doctor treats you, by the way, an MBBS doctor is allowed surgery in India. Okay, just to give a clarity of thought to people. If that MBBS doctor has given you the correct medications, then your treatment outcome is not going to be compromised. The problem is, if you are going to look after a degree of a particular individual, then you have countless gynacs who don't do a single laparoscopic surgery, but have a board put up that they are diploma in laparoscopic surgery from Germany. But they call people from outside to do surgeries inside their hospital, right? So how are you benefited as a patient? Again, I strongly think, okay, look, India एक ऐसा country है जिसमें कोई भूखा नहीं मरता है ना? Because you will always find patients who will do some or the other therapy. Somebody wants to do it close to home. Somebody has a friend who is a doctor. Somebody has a, has a friend who has done treatment from XYZ doctor, so they want to go to him. These are factors which you can't stop in India. Okay, because India does not have an established referral network. So you can't do that in India. इसीलिए इंडिया में बोलते हैं भगवान भरोसे, बराबर? Right? इसीलिए बोलते हैं भगवान भरोसे, क्योंकि भगवान तुम्हें जहाँ पे लेके जाएगा तुम वहां पे जाएगा. Okay, so now it is up to the intelligence of the patient to understand, to do the research, right? To speak to the past patients and then ensure what quality of treatment they want. Because in every city, there will be 1 or 2 good gynacs. In every city, there will be 1 or 2 good reproductive medicine specialists. In every city, there will be 1 or 2 good andrologists who are doing this work with dedication. who are dedicated to this. So the people who are dedicated are the people who are the maximum outcomes. Please remember. Okay.
Right.
So if outcome is your criteria, then you go to somebody who is dedicated in this field. If outcome is not your criteria, then you don't need a dedicated person any which ways. Then you can go to anyone and expect a miracle to happen out of them.
Right. The next question is, how when a male knows that, he's having issues with male infertility, they generally would like to understand that what are the types of male infertility? Is it physical? Is it biological? Is it hereditary? Is it something which is related to their eating habits or lifestyle? So what are the various types of male infertility and what are the treatment options?
See, in majority of the cases, okay, for male infertility, you will not be able to convince a male of the reason for having that infertility. Understanding? As a result of which, तुमको आंसर चाहिए ना कि तुमको गड़बड़ क्यों हो गया, तो तुम्हारे पास में आंसर नहीं है, because there are so many males who are told that you have this problem because you are smoking, you have this problem because you are taking alcohol. Tell me one thing, there are so many males who are taking 20 cigarettes a day. There are so many males who are taking 2 pegs of whiskey every night. They still have 3 children, no? Right? So you are unable to justify a concrete answer unless there is a hormonal evidence, unless there is a genetic evidence. Understanding? In all other situations, you are addressing it to lifestyle factors. In all other situations, you are adding it to your comorbidity. Right? कि हाँ शायद ऐसा होगा. नहीं. Okay, if you don't have an answer, then it is an idiopathic cause. And idiopathic मतलब answer अभी तक science में नहीं है. Right? That is the most common cause of male infertility. The treatable ones, hormonal problems, genetic problems, thyroid बढ़ गया, prolactin नीचे आ गया, all these things are treatable. So the minute you tell them कि देख तेरे को ये problem है, तेरे को ये injection लेना पड़ेगा, तो इससे ठीक हो जाएगा. The guy will do it the minute he steps out of the OPD.
Right. Got it.
That is the beauty of male patients. The minute they are convinced कि हाँ यार ये problem है, ये treatment है, they will not ask mommy. They will straight do the treatment. It is exactly much with female patients, In female patients, they know their problem, but they want to discuss it with their friend, mummy, auntie, chachi, dadi, mausi. They want to have a thorough discussion with everyone and take wrong opinions of everybody. So that is the difference between treating a male and a female. But if you give a correct guidance, they will get the treatment done. Don't worry.
Right. So one is you already said that there are some hormonal, disorders which is treatable. What are the other indications for male infertility? Physical, appearance.
Obesity. In our country, if you look, obesity is one of the most common causes for having male infertility. Yeah, and that is something which is changeable. You can't really say कि मैं मेरा वजन 10 किलो कम नहीं कर सकता, मेरे पास में टाइम नहीं है. That is not an answer. ठीक है? That is a treatable cause. So like that, you have many treatable causes. As I said, hypothyroidism, very common in our country. Okay, for male patients, you will be surprised. Out of 100, there will be 5 to 7 males who are treated for thyroid disorders. The minute they are treated, they are fine. Understanding? Very common, very, very common. Some anatomical problems, male partner is normal, but unable to have proper sexual intercourse. In that situation, doing a circumcision really helps. Melanocystitis, all these small infections. You have to examine the male partner. And once you examine, if you come to know that he is going to be treatable, you must address it immediately.
Got it. Absolutely. Further to this, Dr. Dipesh, there is a question to you here that a lot of newspaper articles talk about that male infertility is increasing. So one of the viewer asked that, is it that male infertility is increasing or the awareness among male partners or awareness among couples have increased and that's why, it has been reported. So what is the reality?
Both is reality. Male infertility is also increasing and the awareness regarding the male fertility is also increasing. Previously, what happened if any patient with azoospermia, they roam from the homeopathy to Ayurvedic to all badas and at that time when they realized then there is a treatment, the wife has a POR. So they can take the 5 years to realize that now initially they are ready for the TISA or something, then wife has to take the donor eggs, then again they take the certain. So both are increased. There is a both there is a factors are coming in.
Got it. Thank you so much. Dr. Jai, other than TEFNA, hormonal treatments and microtessa, what are the other options for treatment of male infertility, and what are the advances in this field?
So if I talk of other options, something which is commonly done for a lot of males is something called as a varicocele surgery. Varicocele surgery is something which is to be done predominantly when the counts are low but motility factors are not there. Okay. And probably now in modern medicine, that is the only remaining indication for anyone to do any form of that therapy. Okay. If you talk of advances which are coming inside in this field, then there is a big scope of something which is greatly researched at this point in time. And that is of doing something called as adipose generated stem cells. Okay. To put these stem cells inside the testis so that males who are experiencing testicular failure, males who are with non-obstructive azoospermia, they get some benefit out of this. But honestly, all that is currently to be told as something which is in a phase of research. And because it is in a phase of research at this point in time, this therapy is at least 5 years to go, before it becomes a reality.
Right. So this is how it goes. The last question to Dr. Jai out here is who are, we talk more about these treatment options, but somebody who is wanting to take some precautions that they may not land up with male infertility, right? What are the precautionary advices which will come from your end?
See, one very good thing which a lot of people are doing these days, I've seen this over the last 5 years, is they are coming for something called as preconceptional counseling. Okay, in the preconceptional counseling itself, they come to know about their status of sperms. Okay, that is one very important thing. Second, see, we always talk of a healthy lifestyle, ye mat karo, wo mat karo, and all these things. It is good to follow a healthy lifestyle, but then there are people with a healthy lifestyle also who have azoospermia. Okay, so yes, maintain a healthy lifestyle, but then there is an asterisk to it that terms and conditions apply. Okay,
right.
Please don't associate male infertility with impotence. That is very important. See, these days, due to stress, office, career, lifestyle, रात को 2 बजे को वापस आएगा, सुबह को 7 बजे वापस ऑफिस जाने का है, all these things, the amount of sexual drive in males has gone down. Okay, that cannot be associated that because now you are having less sexual drive, you are infertile. There is no correlation between having less intercourse and having abnormal sperm counts. Okay, and that is another common misconception, which if this is a platform which people are listening to, then they must listen to this and they must calm themselves down that, okay, you must maintain a good sexual frequency should you want to have a child. But then having a low sexual frequency does not really mean that you have a poor sperm count. Okay, because that is a common misconception which people carry in their head. And because of that, they end up in a lot of complications in marriage. So that is something which they have to keep in mind. And then finally, I think what is important is, see, if you have a problem, remember male infertility is treatable. Okay, a lot of male infertility is completely treatable. Guys, just go to a doctor and treat it now. Why experiment sitting at home? Go to a doctor. तुम तुम्हारे choice के doctor के पास जाओ ना. Go to a doctor which you like the most and get treated. But at least get treated. If you get treated, should you be wanting fertility? And if you get treated, then you will definitely have outcomes. So don't worry about that.
Got it. Absolutely. So now, since you also mentioned about, premarital conception counseling, right? Suppose the male partner finds that he is azoospermia or he has issues related to his sperms. What would be your advice on him, revealing it to another partner or revealing it to the family members? And, then there are some issues related to it.
See, if people come to know of this before marriage, then you are saving 25 lives. You are saving the life of the husband. You are saving the life of the wife. and you are saving the life of their entire family. Okay, both sides. If both the sides accept it and go ahead with it, then it is fine. But I think when patients come to a doctor, they expect honesty out of the doctor. Similarly, when you are tying a relation for the entire life, I'm sure your partner or the family is going to expect honesty, right? And one thing, I think one should be dead honest in this. Tell it to the parents, tell it to the in-laws, or prospective partner, the future partner, and I think move on with it. Because see, at least tumne sach bataya. The least you can do is be honest. The
Right.
worst you can do is know about it and not tell it to people. Right? That is bad. Okay. So, and I've seen marriages breaking because of this, and I've seen marriages breaking because of not telling also. So both the things, right?
Right.
So one must tell this, is what I think.
Understood completely. What are your views on sperm donation cycles?
There are some people who do it, right? Good thing about the government these days is they've allowed people in the family to donate sperms, right? So it stays in the family. And the sperm donation as such is not a very old thing. It has been going on since the time of Mahabharata. So it is not something which is a new concept to India. India has been a very advanced cultural society since 5,000 years. Okay. I think the problem is probably, okay, I don't do sperm donation, so let me put that as a disclaimer. But I think the problem is there are a lot of religious barriers to it. Okay, you can't really end up donating or using somebody else's sperms without telling it to the couple. Okay, nobody likes it. Trust me, nobody likes it. And I think there are a lot of religious barriers still in our country. A lot of caste, a lot of communities, they don't want a sperm donor, and which is fine. Which there is no problem in that, which is fine. Okay, one must one must probably use this only as the last resort, because there are so many countries where sperm donation is not allowed. वहां पे लोग जिंदा रहते कि नहीं रहते हैं ना,
Right.
So that is not the end of life. And I think this is my opinion, and I could have an opinion which is biased because I don't do this procedure. There could be people who do this procedure left, right, and center, and they'll say no, it helps somebody complete a family. That's also a different perspective, and that could be right. So this is my opinion based on my practice.
Right. So since we are talking about male infertility, we talked about these options. We talked about options other than getting treated if you are azoospermia, you don't get sperms even after microtest, after going series of treatments, and still you have this wish to have a family. Right? We talked about an option of sperm donation. And what are your views on adoption policy in India?
It's a brilliant thing. See, the government is very pro for adoptions. Okay. The thing is, what typically happens in India is that people choose to do adoption very late. Because they choose to do adoption very late, they unfortunately end up adopting only those children who are, let's say, 3 years, 5 years, 7 years old. The government guidelines for adoption are very, very straightforward in the country. Very straightforward. You want to do adoption, you need to apply, and 1, 2, 3, 4, 5 things will happen. You submit those documents, and within 2 years, the government clears you to have an adoption. It is as simple as this.
Right. So it was a misconception where people thought that adoption is very complicated, government does not give go ahead, but ultimately you have to apply for it at the right age. That is what I understood from you.
Yeah. See, the government does not want the adopted parents to become 80 years old when the child is 25.
Right.
That is logical. There is nothing illogical in that. That is logical. The government wants the prospective parents to be 55, 60 when the child is 20, 25. That is how my parents are. That is how your parents are. That is how Dipesh Bhai's parents are. That is how parents are. Right? So you can't really say, ye kya hai? You have to say that you were late. You could not make up your mind due to whatever reasons. Nobody is asking you to prove कि अरे ऐसा क्यों, ऐसा हुआ क्या. Nobody is asking you for such reasons. Okay, but this is what it is. This is what you have to do. Simple.
Right. So, Dr. Jai, this would always be a never-ending session with you as always. You have deep dived into the male infertility, all questions of our viewers that we had today, we were able to cover, and that too quickly and very, very clearly. On behalf of Kushi IVF, I would request Dr. Dipesh to end this session with his closing remarks. And thank you, Dr. Jai, with all your enthusiasm, energy, and guidance to all our patients and viewers out here. Dr. Dipesh, over to you.
So, a lot of questions answered by Jai with the straightforward answer, and I would like to conclude that male infertility is treatable. We have the all advanced technology now with the very good success rate with expertise like Dr. Jai at the Kusi IVF. So don't afraid, go to the fertility consultant and do the things on the right ways.
Thank you. Thank you, Dr. Dipesh. Thank you, Dr. Jai. With this, we end our 1 week long infertility session and infertility awareness session, and we'll get back to you again and again. Thanks a lot. Namaste.
Always. Thank you so much. Bye.
Thank you. Bye.